Hey, I'm Trent Swoverlin with Mallers and Swoverlin Physical Therapy. I'm here with Ben England, a therapist of ours. We want to talk to you about some headaches today. Ben, what's your thought on headaches?
Yeah, so headaches traditionally have been thought to be one category. Anybody that had any type of head pressure, head pounding, throbbing, any headache that came from the neck or muscles, they just put it into one category of headaches. However, the International Headache Society actually broke down headaches into about 14 different categories, and then each of those categories have a lot more categories beneath that. But in physical therapy, we like to stick with three simple categories of tension type headaches, migraines, and cervicogenic headaches. So as far as cervicogenic headaches go, ones originating in the neck, some of the muscles, in the shoulders, the neck, causing those headaches. Tension type headaches being the bilateral head pressure, typically comes on with stress, those types of things, as well as migraines, which traditionally have the light sensitivity, the smell sensitivities, and then the aura or splotches that people see. So as far as headaches go, what's your go-to, some of your go-to interventions in the clinic? Well,
First of all, I think that people come in here and think headaches are normal. Headaches are not normal. If you're having a headache,
right,
that's not a normal sign. People come in here all the time. I've had headaches for years. I thought everybody had a headache, and we don't.
Yeah.
So, as a therapist, a manual therapist, there's multiple things that we can do from a manipulate soft tissue mobilization, just a plethora of things that help alleviate a person's symptoms. We can do it very quickly. So don't think that you're going to come in here and, I've seen somebody else, or I've been here or there. We can help you immensely. We're going to talk about wellness.
Yeah.
Migraine sufferers, especially, we know that caffeine, chocolate, processed foods, you got to avoid those things. Alcohol intake. You can't just cut all that stuff out completely because you can also get a migraine.
Right. You get rebound migraines, rebound headaches from those.
Right. So you really got to, you can kind of eliminate your diet a little bit and find out what those triggers are. But those are definitely the triggers that are there.
So one of the things I like to do, is dry needling. So dry needling is something that you do, something that I do in our practice that, once again, same day relief. People come in, migraine, headache, tension type headache, whatever that is. There's a series of, needles that we can use on the back of the neck, on the face, that really help out these people. Oftentimes if we can reproduce the headache in the clinic, we can figure out where the symptoms are coming from. A lot of times with migraines, people have this stigma that they can't exercise, or they're not supposed to exercise, they're not supposed to move because it can make their headache or migraine worse, when in reality, a lot of the literature, a lot of the neurology journals, they support exercise, they support heavy resistance training, doing functional tasks, not simple dumbbell curls at the gym, but, squats, overhead press, doing things that involve both extremities with good posture.
80% of people come in here are at a computer, they're on their phone. Look at these kids these days. You can see their posture changing all the time. We can talk about, they lost my cervical lordosis. So what? It's not a big deal. We can definitely give you specific exercises that create better neutral spine position. We can create some deep postural muscles that are working well for you during those days. Teach you ergonomic awareness at your computer or on your phone.
Yeah. What we're trying to paint a picture of is long-term management, right? Everybody, on each corner, every PT says, okay, well, I can crack the neck and my patient's better today. Well, that's great. However, at the same time, if you're not following that up with adequate education on hey, what should I be eating? What foods should I be avoiding? What exercises should I be doing long term? And working closely sometimes with that patient's neurologist to get those outcomes that those patients need. But really, we're looking at it from more holistic and long-term management.
Yeah, if you're suffering from headaches of any type, maybe you've never seen your doctor, always consult with your physician. Don't always. But we're here. We can definitely put you through a thorough exam and kind of guide you where you need to be from a physician standpoint as well.